do understand that the world becomes more prone to the crisis. We are living in the edge of chaos. From COVID-19 that a lot of epidemiologists assume will not be the last health crisis in our history of mankind due to the shift on humans' environmental conditions. We also will definitely encounter environmental crisis due to the climate change and sea level rising. Another thing in the crisis bucket list is geopolitical and conflict-related crisis with rising regional tensions and competing political agenda. And to some extent, economic crisis like what happened in 2008 that could reoccur due to economic volatility and global uncertainty and economic factors. Considering these four potential crises, health, environmental, geopolitical, and economic crisis, it is crucial to have more skilled individuals to join the workforce to prepare against the systemic risk in our life. The problem is a lot of individuals are still demotivated from the socially utile careers, primarily because of financial reasons. 2 points of setup here. Number one, government agencies in collaboration with experts and relevant industries will work together identifying jobs that are crucial during crisis based on data, statistics, and past precedents. This could include healthcare workers, emergency responders, public health experts, and essential service providers. Number two, this will be public mandate. It means if government is the provider of these jobs, government will allocate state budgets to increase the salary of these jobs by 30 or 40%. However, if these jobs are situated in private companies, the government will oblige the companies to inflate the wages. And if the companies are unable to pay the salary increase, the government will subsidize the companies. The bottom line is our policy is financially and logistically feasible 100%. 2 points of arguments. Number one, why is there an urgency to artificially inflate the wage of the socially utile jobs? Number two, why has our proposal become the prerequisite of preventing a crisis? Or in the event of future crisis does occur, how does our side solve it faster? We're also going to analyze why this is the most economically efficient spending from the government's budget. So on the first argument about urgency, we need to talk about what types of jobs that we're talking about. If you want to solve environmental crisis, we need to invest more on renewable energy professionals, environmental scientists and ecologists, climate adaptation planners, sustainable agricultural specialists, and so on. If you want to prevent health crisis, we need to have more healthcare professionals, emergency responders, public health experts, research scientists, and analysts. And if you want to prevent future geopolitical crisis, we need to invest more on conflict resolution specialists, diplomats, and foreign relations specialists. So there are three structural reasons why these jobs that are severely underpaid in comparison to their potential output, and why then urgently government need to artificially inflate the prices. The first structural reason is that there is a lack of market valuation towards the socially utile jobs. Some roles that are vital during crisis, such as healthcare workers or essential service providers, might not be valued appropriately in the market during normal times. This can result in lower pay as market demand and supply dynamics play a significant role in determining wages. However, this market demand and supply dynamics is very short-termistic bias. They underestimate the chance of future crisis occurring. With less organic demand during normal times towards this job, the salary valuation becomes low, making this job severely underpaid, barely passing the minimum wage for a lot of these professions. Number two, there is a lack of profit motive. Many jobs in the social impact sector, such as social work, environment, and healthcare, are often driven by a mission to serve and improve communities rather than by profit generation. This perception is harmful because this can limit the financial resources available to organizations and result in lower salaries for workers. Let's be clear here. I want to make a crucial preemptive argument to opposition side. Opposition couldn't argue that artificially inflating the wages of this socially utile job would change the essence of the job from passion to money. No, because I think they will not be 100% profit-oriented, because altruistic, socially driven individuals will become health professionals anyway in both sides. This is symmetrical because they want to bring betterment in this world anyway. The people that we want to persuade specifically in government side is to the people that are still profit motivated to enter this industry. And I think that's okay because people need money to survive and because we want to get as many workforce as possible to prepare against future crises. Number three, there is funding constraint. Organizations in the social impact sector, including nonprofit and public agencies, often rely on funding from donations, grants, or government budgets, and because of their future value instead of their current value, these industries have a problem of lack of investment. Limited funding can lead to constraints on salary budget, making it challenging to offer competitive wages to workers. So there is more urgency for the government to subsidize this firm to artificially inflate the price of these wages. So the conclusion of my three structural reasons as to why these types of jobs become organically underpaid is that this situation makes it urgent for the government to intervene because the status quo job market supply and demand mechanism no longer works. Individual motivation to join these jobs are severely limited, and the allocation of funding to pay for these jobs are not allocated properly. Government must interfere and inflate the price of these wages. My second argument is about why has our proposal become the prerequisite of preventing a crisis, or how do we solve future crises better, or why this is the most economically efficient spending from the government's budget. There are 4 reasons how we could prevent crisis or solve crisis better. The first reason is that we're going to prevent brain drain. Instead of going to the high-paying private sector, such as becoming investment bankers, stock traders, lawyers, or any other capitalistic jobs, now we can incentivize the brightest minds of our generation, the fresh graduates with high GPA, valedictorian, the most outstanding students to enter the social utile jobs. Why is this important? Because increased wages might attract professionals to research and develop solutions relevant to the crisis prevention and management. Better research means better early detection of pandemic, better development of renewable energies to dwindle environmental crisis, better conflict mediation in the escalating geopolitical conflict, better ideas on economic policies that help prevent financial crisis. The most talented individuals become social utile workers is the prerequisite of preventing crisis. Number 2, in the event of crisis do occur, at least we can ensure critical services to be prepared and resilient by preventing labor shortages. Crisis often lead to workforce shortages in essential sectors due to increased demands, health concerns, or thousands, if not millions, of people need help. Just see the COVID-19 that strained the health professionals' resource. There was not enough nurses to take care of incoming patients 24/7. Artificial inflating wages can attract more individuals to take up these roles, potentially mitigating labor shortages and maintaining necessary services. This approach can help avoid situations where critical services suffer due to insufficient staffing. Number 3, we can reduce long-term costs. So this is where I'm going to explain why this is financially efficient for the government. Addressing crisis effectively by having sufficient workforce can prevent further escalation of the situation and reduce the need for costly emergency intervention. Investing in crisis response jobs can help avoid this larger payment down the line by having fewer cases, reducing strain on healthcare system, better recovery, and ultimately lower economic costs associated with health emergency. This is definitely the most cost-saving policy that the government can make in the eyes of crisis. Number 4, we will have strengthened public trust because fair compensation for essential workers means we have more staffing, means that crisis solve faster, means that we can boost public trust and confidence in the government actions during crisis. This is crucial to maintain social order and cooperation during challenging times, making sure we have better recovery. Conclusion is not only we save more people, we fight crisis better, we also save government money in the long run. Very proud to propose.